My name is Cliff Robinson. I'm a professor of radiation oncology at Washington University in St. Louis. I'm the director of clinical trials and chief of the stereotactic radiotherapy and thoracic oncology services. When we deliver stereotactic radiation, there are a number of possible things that can occur along the way. And I like to think of the side effects as being things that may happen immediately, those things that may happen a few days or a few weeks afterwards, and those things that may not happen for several months later. The things that can happen immediately really relate to what part of the body we're treating. If I'm treating your brain and we're giving precision radiation to the brain, there's a chance that you may get some headaches or feel sick to your stomach or possibly even have a seizure. Fortunately, those risks are very low, typically in the single digits of percentages. If we treat you in the lung, well, really, there's very little that can happen immediately during the treatment. Most patients come to me afterwards and wonder if whether we've been treating them at all. Down in the belly, you can get some nausea as well, because these are sensitive organs to radiation. So the point is that it really depends on where we treat you. Most people, however, experience no acute or short-term immediate side effects to stereotactic radiation. In the days and weeks afterwards, there can sometimes be some immediate inflammation that occurs. And again, those same areas, you might imagine, the side effects you get will be related to where we treat. If that happens, typically we'll reach for things like steroids or other anti-inflammatories to reduce that inflammation. Again, that risk is typically in the single digits. In the months afterwards, those same problems can occur, although sometimes they can be a little bit more troublesome to deal with. So a classic thing that may occur would be radiation to the lung using stereotactic radiation, where 6 to 12 weeks later, there's about a 5 to 10% chance that you could get a side effect called radiation pneumonitis or inflammation of the lung. Now, fortunately, it tends to be easily managed with a course of steroids, although you may need to take those steroids for several weeks before that goes away. And in rare cases, it may require even more drugs. It's also more common in people that have pre-existing lung problems where there is inflammation in the lungs already. Not the classic emphysema COPD that most people come to me, but more rare conditions where there's inflammation already, such as interstitial lung disease. Overall, however, fortunately, the risks are low. You do not feel this radiation being delivered at all. It does not hurt in any way. It's completely invisible. And so ultimately, we're very pleased with the fact that patients can get through this typically with few or no side effects.